going on, guys? What's going on? I'm back. Thank you for tuning back in. Welcome to a rebroadcast of Kidney Disease Education Moment. I am your host, Steve Belcher. The reason why I did a rebroadcast of this show is because I got so into this education moment that after one of my PSAs, I forgot to turn my mic back on. So a lot of information that I said, excuse me, wasn't heard. So I'm going to do another broadcast of what I went over and what I talked about. All right, so here we go. If you can hear me, give me a thumbs up. Give me a thumbs up if you can hear me loud and clear. Let me get a thumbs up if you can hear me. So, again, this broadcast is titled Heparin and MRSA, What You Need to Know. Okay? So you may be asking, what is heparin? Steve, what is heparin? I may heard of it. They give it to me in my unit. I hear about heparin, but what exactly does it do and what is it? Well, heparin is an anticoagulant. Okay? Heparin is an anticoagulant, a blood thinner. It prevents blood from clotting. So when we say it's an anticoagulant, let's break the word anticoagulant up. Anti means against, coagulant means causes clotting, thus equals anticoagulant. So heparin is just a medication that prevents you from clotting during your hemodialysis treatment. So why do dialysis patients need heparin? Why do you need heparin to run on dialysis? Let me tell you why. So when blood is outside the body, it clots. You've seen it. You may have scraped your knee, cut your finger, seen some blood drop on the counter, on the floor, and in about a couple of minutes, it turns hard or dark. It's clotted. Whether due to an injury such as a scraped knee or due to it traveling through a dialyzer, blood will coagulate or clot when it is no longer safe inside one's body. Typically, each ounce of blood poured from the body during a dialysis treatment only remains outside its blood vessel home around 45 seconds. All right? But this is enough time for the clotting process to occur. So just imagine 45 seconds. If you're on dialysis and halfway through your machine stops working or they have some type of problem or malfunction and your blood is just sitting there, the pump is not spinning, guess what? You're at great risk for clotting, especially if it's sitting longer than 45 seconds. All right? So please be mindful. If your machine stops, if you see that blood pump stop spinning, ask them what's going on, because each time that blood pump stops spinning, it puts you at greater risk for clotting, especially if you don't get any heparin. Whether this clotting occurs in the dialyzer or in the bloodlines, this clotted blood can no longer return to the patient. So if your blood clots, we can't return it back to you, whether it's in the lines, as we call the circuit, or that dialyzer. If the blood clots in there, you're not getting it back unless they return it from the arterial. And if the arterial's clotted, you ain't getting nothing back. So if that happens, you need, next time you go to treatment, you ask them to do H&H, which is a hemoglobin hematocrit draw, to see what your blood count is. So to prevent this loss of blood, heparin is typically given during the dialysis treatment, so your blood won't clot during the treatment. Some is given through the needles immediately prior to the start of the treatment, and more is given via a pump during the treatment. Both of these amounts are ordered by your physician. So normally what's supposed to happen, or what we did back in the day for a company, I worked for DaVita and Fresenius. So basically, according to their policies and procedures, the last time I worked for them, when you put the needles in, you get a heparin through the venous line, and you wait 5 minutes before you connect the patient to the lines, because you wait 5 minutes to give the heparin enough time to recirculate in the body. All right. The term tight heparin, you may have heard that, tight heparin. We're going to give you tight heparin. Tight heparinization is used when, because of a medical reason, the amount of heparin given is reduced or lowered. For example, if a patient just had surgery or is to have surgery soon after dialysis treatment, the dose will be reduced to minimize bleeding. And emphasize this in the first broadcast. Ladies, if you still have your menstrual cycle, let the charge nurse or the caregiver know, especially if you get heparin, because during these cycles, if you're getting heparin and they don't know, you could be bleeding more heavily than normal. So please be mindful and aware of that. If you are menstruating and if you do receive heparin, make sure you let the charge nurse know, the technician, or really the charge nurse, so she can reduce it. And then make sure she lets you know, or they let you know how much they're cutting the heparin amount. Or just don't take any heparin and have them flush your kidney. Okay, each half an hour or each hour. If you don't get heparin, make sure they flush your kidney to make sure that it doesn't clot. And what they flush, say if they flush the kidney every hour with 100 cc's, you make sure they add that back into what they're pulling off. Okay, so you got to pre-plan this before treatment. So if you're 3 hours and I'm going to rinse your dialyzer every hour with 100 cc's, I'm going to add in 300 cc's or maybe 250 cc's of normal saline. I'm going to add that into the gold so I can pull that back off so you don't leave out heavy. Okay, so the key point to all this concerning heparin, the big key point takeaway from this is, one, let your care team know before beginning of the treatment if you had any recent bleeding, like a nosebleed, if you have hemorrhoids, menstrual cycle, you got surgery planned. Let the care team know what's going on. Also check to see if you get heparin, and if you do, how much you get. If you have any post-bleeding after dialysis that's longer than normal, see how much heparin they gave you. Also have them do an access check to see if any narrowing is occurring in your access, because if you have a narrowing, normally it happens in the venous line. If you start getting a narrowing, it can cause you to bleed longer. Okay, so let me see. Definitely, if you got a surgical procedure, make sure that the day of dialysis or after, make sure you have that surgical procedure scheduled for later in the day. Then most of the time, the dialysis team, the doctor or the charge nurse, will decide the heparin dosage, should it be adjusted downward for that particular treatment. So with that being said, that's the end of the heparin education. I hope that helps someone, that education piece about heparin. If you didn't know about heparin, I hope you know about it now. And the effects, if you get too much heparin, it can cause you to bleed longer than normal. So that's why you want to know how much amount of heparin bolus you get if you get heparin, because to err is human. The technicians draw up the heparin. When they're rushing, they may see your name and someone else's name and think the other person is you and draw up, say you're supposed to get 4,000 heparin, they might draw up 6,000 heparin. So you got to watch, and when they about to minister the heparin, ask them to let you see it, to see if your name is labeled, because your name is supposed to be labeled on that syringe with the amount of heparin that you receive, okay? Don't just let them come to you with a syringe with no labeling on it, with something in it, because it could be anything. It could be saline, it could be a placebo. I mean, we hope it for it to be heparin, your medication, but you just never know. So now, the last portion of this education moment, we're going to talk about MRSA, also known as MRSA. Okay? So news media throughout the country in the past were talking about MRSA, and reporting on recently released CDC for disease control information. Why is it wise for dialysis patients and the staff to be informed about MRSA? Do you know? Please, if you're watching this broadcast, share this information. Please, if you could participate, because we're trying to give you the ultimate learning experience pertaining to dialysis education, so you can be well prepared when you enter this facility of what's going on. So, what is MRSA? What is MRSA? MRSA is pronounced MRSA, MER-SAH. What is MRSA? Does anyone know who's watching this? If you receive hemodialysis, do you know what MRSA is? Have you heard of MRSA? Have you? Well, I'm about to tell you what MRSA is right after a PSA by Urban Health Outreach Media. Enjoy.
Chronic kidney disease is a serious and growing public health problem in the United States. More than 20 million Americans aged 20 and older may have chronic kidney disease. In addition, many African Americans with risk factors, diabetes, and high blood pressure do not know they are at risk. Are you at risk? Be aware, get tested. For more information, contact the Urban Kidney Alliance Inc. at 443-814-1541.
Are you at risk? Get tested. The life you save may be your own. So, what is MRSA? I want to tell you what it is. Also pronounced MRSA, stands for methicillin resistant Staphylococcus aureus. So I'm going to break the word down. Staphylococcus aureus is often referred to as staph. Is a type of bacteria that is often present on skin or inside the nose flares of healthy individuals. If, however, these bacteria get under the skin, an infection can occur. Bloodstream infections, also called septicemia, urinary tract infections, and pneumonia, can also be caused by staph. Methicillin is a type of penicillin. It was developed in 1959, but later replaced by other forms of penicillin. Then the word resistant means that the bacteria will no longer be killed by an antibiotic. Thus, MRSA is therefore a Staphylococcus aureus organism that has become resistant to all antibiotics. So you can have something that's resistant to all antibiotics. That's why this broadcast is very important for you to know. Who gets MRSA? Who gets it? Well, look, staph infections occur more often in people with weakened immune systems. Persons with chronic illnesses, such as diabetes and kidney failure, are therefore at greater risk. Let me repeat that. Persons with chronic illnesses, who gets MRSA? Staph infections occur more often in people with weakened immune systems. Persons with chronic illnesses, such as diabetes and kidney failure, are therefore at greater risk. According to the CDC, MRSA infections are seen more commonly, listen to this, more commonly in healthcare facilities such as hospitals, nursing homes, and dialysis centers. Let me repeat that. According to the CDC, MRSA infections are seen more commonly in healthcare facilities such as hospitals, nursing homes, and dialysis centers. When an MRSA infection originates outside of the healthcare setting, it is then known as community-acquired MRSA infection. With this form of MRSA, skin infections, most likely like pimples and boils, are usually seen. How many people got boils between their legs, in their groin area? Pimples. Can MRSA be prevented? Give me a thumbs up if you're watching, if you think MRSA could be prevented. If you think it could be prevented, give me a thumbs up. Do you think it can be prevented? Have you even thought about MRSA if you're a dialysis patient? Have you heard of it? Has it come across you? MRSA, can it be prevented? Well, we're going to find out right after this PSA. So, can MRSA be prevented? What do you think? What do you think? Can MRSA be prevented? Can MRSA be prevented? So listen, my mic on? Yes. Staph aureus infections are more likely to spread from person to person if close skin-to-skin contact is present. Hygiene is poor, living conditions are crowded, or skin is not intact, as seen with cuts and abrasions, or at the catheter exit site. So that's why if you have a catheter, we tell you to keep it covered, and when you go get your dressing changed, you wear a mask over it, make sure it's covered over your nose, and the technician or nurse wear a mask, because again, this is where the MRSA, this is where it's found, in the flares of your nostrils, okay? To help avoid a MRSA infection, this is what the CDC feds recommend. Please pay close attention to this so you won't fall victim of MRSA. Keep your hands clean by washing them thoroughly with soap and water. Just don't use hand sanitizer. Wait a minute. Just don't use hand sanitizer. Use warm water with soap, okay? Or alcohol-based hand sanitizer. 2, keep cuts and scrapes clean and covered with a bandage until healed. 3, avoid contact with other person's wounds or bandage. 4, avoid sharing personal items such as towels or razors. Okay. 5, avoid dialyzing with a hemodialysis catheter. Use only when essential. 6, if a hemodialysis catheter is in place, again, wear a mask during put on and takeoff. Wear a mask. 7, when holding your access site post-treatment, wear a glove and remove it before leaving your chair. Then wash your hands. So the most important part of that last broadcast where my mic was cut off, I was talking about, listen guys, think about the dialysis unit. When you first come into the door, when you first go into the door of the unit, the treatment, those door handles, so many people touches them, especially if it's a 30-chair unit. If you got all 30 chairs filled up each shift for one day, that's 90 patients touching that door. Okay, you got people picking their noses, scratching in their crevices, their groin area. They may be itching, digging deep. So this happens, and some people may not wash their hands and they touch the doorknob even after holding their sites. And if they don't wear a glove and they start bleeding and their hand got bloody, they may not wash their hands after that. This happens. So what do you do? All right? What do? You grab a hand sanitizer. You bring your own hand sanitizer. All right? Meaning the cloth, hand wipes, Lysol wipes. Get you a packet, bring it with you, and when you're about to go into the unit, the dialysis clinic, use that wipe to wipe off the door. In fact, I encourage you to use it to open it, and then get a new one and open the other one with it. You gotta be prepared. You don't want to get caught with MRSA. All right, again, hundreds of people are going in dialysis every day, touching that door handle. What about people who use the bathroom, who don't wash their hands? All right, you got to think about this stuff. They touch door handles too. You got to touch the handle to get out and leave, to get in and get out of the bathroom. Those handles are dirty. Just because you can't see physical soil stains on the handles doesn't mean that they're not infected with germs. So be aware, guys. Be aware. And then, last but least, can MRSA infections be treated? Can they be treated? The answer is yes. Antibiotics other than penicillin can be used to treat MRSA or MRSA. Treating these infections, however, is sometimes difficult. It's really difficult. I've seen the treatment in progress. All right? And sometimes the unit may not even have the antibiotic to treat you with it. It may require special antibiotics. Plus, successful treatment may take longer. Following measures to avoid infection is, of course, the best approach. Like I said, just follow the measures that I outlined to help you avoid MRSA infections. All right? So with that being said, we're going to end this broadcast. I thank you guys for tuning in for a rebroadcast. I just wanted to make sure that people heard that information loud and clear. All right? So before we leave our broadcast, I want to entertain you with one more PSA broadcast. Please enjoy.
Do you know you could have kidney disease and not even know it? 9 out of 10 people who have stage 3 chronic kidney disease do not know it. The rate of kidney failure for African Americans is 3 times higher than among Caucasians. And one reason for this is that they are not aware when they have earlier stages of kidney disease. At a time, treatment could prevent the damage from progressing to the point when dialysis or kidney transplantation is necessary. In addition, due to high rates of diabetes, high blood pressure, and heart disease, Blacks and African Americans have an increased risk of developing kidney failure. African Americans need to be aware of these risk factors and visit their doctor or clinic regularly to check their blood sugar, blood pressure, urine protein, and kidney function. Be aware. Get tested. The life you save may be your own. For more information, contact urbankidneyalliance.org.
All right, guys. Again, get tested for kidney disease. The life you save may be your own. So again, thank you for tuning in for a rebroadcast of Kidney Disease Education Moment special education broadcast. Title tonight was Heparin and MRSA, also pronounced MRSA. We hope you enjoyed it, and we look forward to you coming back and joining us again. Tune in this Wednesday, 8:30 p.m. Eastern Standard Time for another edition of the hit show Warriors Quest with Jared A. Brown, half duo of the Brown Brothers production team. Thank you guys for tuning in. Love you guys. Keep watching, and we're going to give you the best kidney disease information that we can. Stay encouraged. God bless. I am out.